Asthma devices. For young children usually consist of an inhaler, spacer with a mask, or a nebulizer. I'm showing the 5 rights of giving medication information again because it's important to give the medicine the right way. As you can see from the pictures, the inhalers and spacers with masks come in different colors and shapes. The nebulizer mask and medicine cup for your nebulizer may look different than the one you see here. The good news is that they all work the same. Please read the manufacturer's directions in the package insert for the inhaler. The directions for the spacer with the mask will be on the box it came in. If you are unsure after this training on how to effectively give medicine through an asthma device, please ask the doctor or specialist to show you. Using a spacer means that the child will get more of the medicine in his or her lungs where it is needed. As you can see from the pictures, the person on the left is getting more medicine in his lungs with the spacer. The person on the right is getting the majority of the medicine in the mouth and in the stomach. The reason for this is that the medicine in the inhaler shoots out very fast. It hits the back of the throat and is swallowed into the stomach. The medicine in a spacer allows for the medicine to swirl in the tube and to be inhaled into the lungs. 80% or more of the medicine gets into the lungs using a spacer. Not using a spacer, only 30% of the medication gets into the lungs. Remember to use a spacer every time the inhaler is needed. Keep the rescue inhaler and spacer in close proximity to the child with asthma at all times. Use the spacer with long-term controller or steroid inhaler if it needs it. Important information is found on this slide regarding spacers and nebulizers. The devices or parts do need to be replaced periodically. Per a respiratory therapist, the nebulizer kit's tubing should be replaced about every 2 weeks and the nebulizer mask once a month. The spacer should be replaced every 3 months. Medicaid allows 4 spacers a year. For other insurances, check with your insurance's customer service department. I know that sometimes it's not obtainable to replace the devices when indicated, but replacing the parts as frequently as you are able and as insurance allows is encouraged. If a child is requiring a spacer for home, school, and childcare, ask the healthcare provider to write a prescription for the number of spacers needed. Note that you may not be able to pick up all the spacers at the same time. Usually insurance will authorize 1 spacer per month. Ask the pharmacy to accommodate your request and that you will pick up the spacers in the following months. Note that until you obtain all the spacers needed, the spacer may need to travel back and forth with the child until another one can be obtained in the next month. The next 2 slides are short videos showing correct inhaler technique and correct nebulizer technique.
A spacer is a holding chamber that attaches to an inhaler. It helps you get more medicine into your lungs and less in your mouth. Using a spacer with a face mask takes practice, but we'll show you how to do it. First, wash your hands thoroughly. Next, take the cap off of the inhaler. If this is the first time you're using your inhaler, or you haven't used it in a while, prime it by squirting the inhaler 3 to 4 times away from your face until you see the medicine come out. Then attach the inhaler to your spacer with the face mask. Shake the inhaler and spacer to mix up the medicine. To use the inhaler, stand up straight and breathe out slowly. Place the face mask over your nose and mouth so it forms a tight seal. Press down on the inhaler to put 1 puff of medicine in the chamber. Breathe in and out 5 to 6 times. Use your fingers to count your breaths. If your dose is more than 1 puff, shake the inhaler and repeat these steps. Then remove the inhaler from the spacer and put the cap back on the inhaler. Finally, rinse your mouth with water and spit out the water. You're all done. Good job. A nebulizer uses a machine that makes a mist of medicine to breathe in through a face mask or mouthpiece. Your child's doctor or nurse will tell you how much medicine to put into the nebulizer. For the best results using a nebulizer with a face mask, follow these steps. First, wash your hands thoroughly. Next, place the face mask on the nebulizer container. Then, attach one end of the tubing to the bottom of the nebulizer container. Attach the other end of the tubing to the nebulizer machine. Next, open the plastic vial of medicine. Pour the vial of medicine into the nebulizer container. Now, put on the face mask so it covers the nose and mouth. Make sure the nebulizer machine is placed on a flat, steady surface and plugged into an outlet. Turn on the machine. Take slow, deep breaths with the mask on. The treatment will take 6 to 10 minutes. You will know the treatment is complete when you hear the sound change to a sputtering noise. There will still be a little medication in the container. Do not hold the mask away from your face while breathing in the medicine. Remove the face mask and turn off the nebulizer machine. Wipe your face and rinse your mouth out with water. Be sure to spit the water out. Do not swallow the water. You're all done. Good job.
I hope those 2 videos were helpful as a demonstration of proper use of a spacer with a mask and nebulizer treatment. The next few slides, we will be looking at how to clean the devices. It is important to clean the child's inhaler once a week or more if recommended so that it does not clog. Do not clean the metal canister or get it wet. The first thing that you need to do is wash your hands. Then take the canister out of the plastic inhaler cover. Take the cap off the inhaler. Hold one end of the plastic inhaler cover under warm water for 30 seconds. Turn the plastic inhaler cover upside down and run that end under warm water for 30 seconds. If needed, use a toothpick to remove hardened medicine from the small hole inside the plastic inhaler cover. Shake off any water on the inhaler cover and then place the cleaned parts of the inhaler on a paper towel and let it air dry. The spacer with the mask also needs to be cleaned once a week. Follow these steps to clean a child's spacer with mask. First, wash your hands. Then pull off the flexible back of the spacer where the inhaler goes, if it'll come off. Twist off the front of the part of the spacer. There are different spacers and some you may not be able to twist or pull off the parts. Then soak the parts in mild soapy water for 15 minutes. Rinse the spacer parts in clean water. Shake off any water on the spacer. And let the spacer parts dry on a paper towel. Stand the spacer up to dry. Do not dry the spacer with a cloth towel. It can leave lint in the spacer. Also, drying the inside of the spacer tube can rub off a special coating made to prevent the medicine from sticking to the plastic. Note that you can wash all the parts of the spacer, including the face mask, in a dishwasher. Just make sure you put it on the top shelf. Cleaning the nebulizer machine and parts prevents the spread of germs and keeps the child from getting sick. This is the family education sheet for how to clean a nebulizer. It is recommended to wash the parts of your nebulizer after each use, including the mouthpiece or mask, top piece, and medicine cup, and thoroughly clean once a week. To start, take the nebulizer apart by removing the tubing and setting it aside. The tubing should never be placed under water. Remove the mouthpiece or mask, the medicine cup from the top piece, and place them all onto the top shelf of the dishwasher. Shake off excess water and let the pieces air dry in a cool, dry place until the next use. Or you can wash the medicine cup, top piece, and mouthpiece or mask in warm soapy water and rinse. There is another option for cleaning the nebulizer parts, and that's using a vinegar cleaning method. You would want to soak the mouthpiece or mask, top piece, and medicine cup in white vinegar and water solution for 30 minutes, or as recommended by the device manufacturer. After 30 minutes, rinse and air dry and put it in a cool, dry place. Clean the surface of the compressor and the outside of the tubing with soapy cloth or a disinfectant wipe. The compressor and the tubing should never be submerged in water. And remember, most compressors have an air filter that will need to be replaced every 6 months, or as recommended by the manufacturer. For more nebulizer demonstration videos and information, please visit the American Lung Association's website. Each child should have an asthma action plan in case of asthma symptoms or a severe asthma episode or attack. Ask yourself, does the plan make it clear what action to take, what medicine to give with what device, who to call, or when to call the doctor or 911? Do you have medicines and devices on site to safely and effectively care for a child with asthma? Do you have the instructions for medications and devices? Creating an asthma bag is a great way to have all the asthma medication, devices, and information in one place, like the asthma action plan, cleaning instructions, and the asthma signs and symptoms sheet. If you need to leave the premises quickly, all of the supplies and information to care for a child with asthma is in the bag. For outings, this bag can be easily taken with you. Remember, everywhere a child with asthma goes, their rescue medicine should go too.